Community organizations and labor in San Francisco are on the verge of winning a years-long battle against a massive hospital development that will significantly alter the landscape of health services in the city. On the one side, there's California Pacific Medical Center, the largest and most profitable healthcare provider in San Francisco. They wanted to build a new centrally located mega hospital that would meet new earthquake requirements. On the other side, a labor community coalition fighting to ensure quality health services in and for marginalized communities.
It was a matter of insisting that if CPMC wanted to carry out their business plan, they had to do it in a way that would serve all of San Francisco. So it became a big fight for social justice.
Ironically, it was CPMC's anti-competitive practices that put them in control of an important charity care hospital, St. Luke's. Since taking over the hospital, CPMC had constant battles with the California Nurses Association, including fighting over who pays for healthcare benefits.
The way that they cut health benefits to nurses was particularly incredible because they were a healthcare company employing nurses, and they wanted to make nurses pay more to get healthcare from them.
Community groups and labor organized in coalition against CPMC when they came out with their institutional master plan in 2008. It included building a 555-bed hospital with specialized services and a medical office building at Van Ness and Geary on Cathedral Hill. Hospitals had to meet new earthquake safety requirements. CPMC wanted to build new facilities instead of retrofitting their existing hospitals.
They were going to close inpatient care at the Pacific campus. They were going to close the California campus altogether. And consistent with that, they were going to close inpatient care at St. Luke's and argue that all inpatient care will now occur at this highly specialized hospital at Van Ness and Geary.
One of the major issues that community and labor groups were concerned about was the closure of St. Luke's.
St. Luke's is the only private nonprofit hospital in the southeastern half of the city. And you think about some of the neighborhoods that means. It's like Baby Hunters Point, it's Bernal, it's Mission, it's Excelsior, it's Ingleside, and who lives in those neighborhoods?
I've been outreaching in the Excelsior neighborhood for about 3 years now, and I do spend a lot of time there. So what I see is that I do notice a lot of people of color. There's been a lot of people who are not insured or they have inadequate health care.
Most of the people really go to St. Luke's in this area. They don't ask so much as long as you have your Medicare, medical, and it's okay.
If services at St. Luke's Charity Care Hospital were to close, then poor and uninsured patients would have little choice but to access San Francisco's public health facility, SF General. But with no citywide health planning, some services at SF General, like inpatient psychiatric units that were being shut down at St. Luke's, might not have the capacity to absorb additional patients. Those patients would likely end up in the public health system's emergency care, or the public health system would have to increase services at a cost to taxpayers.
What we discovered was that on the way to CPMC trying to close St. Luke's outright, that it really felt like death by a thousand cuts, that they were continually undermining the hospital and making it less of a viable hospital so that when they hit the 5-year mark and completed their commitment, they could say, see, this isn't a functional hospital, we need to abandon it.
When the development plan to build a new facility on Cathedral Hill became public, groups throughout the city started mobilizing against the plan. 2 coalitions consisting of community groups and labor joined forces to stand up for the needs of workers and marginalized communities.
When we talk about the ideal of community and labor working together for progressive social change, that's a wonderful goal, but we all know that it's really hard to maintain.
Most of the members of the coalition were nonprofit, community-based organizations, and they were going against the huge resources of CPMC Sutter. The groups also had to learn how hospitals do business to understand what CPMC was telling the public.
They spent years hiring one consulting group after another and marketing firm and pouring enormous sums of money into advertising and publicity stunts, and then bringing men in suits to hearings who would throw down reams of paper on tables and say, this proves that we're right and you should give us whatever we want.
This was going to be a huge development. a big hospital on one of the busiest intersections in the city, a medical office building across Van Ness Avenue with a tunnel underneath, a parking garage. They were going to also become the largest private employer in San Francisco. So these were like huge stakes, and the leverage we had was the development proposal, was the city's the authority to approve or amend a plan for development.
The land use approval process became the public's forum for speaking out on issues such as healthcare, employment, housing, and transit. In San Francisco, development proposals of this scale ultimately end up at the Board of Supervisors for a final decision.
So one of the demands that the coalition was pushing for was that, any agreement between St. Luke's has to have a plan for the viability and sustainability of St. Luke's for the long term.
Despite the coalition pushing back, CPMC kept pushing their development plan forward. A critical moment came in spring 2012 when the Board of Supervisors did not approve the plan.
Because of the successful work of our coalition in presenting a broad, unified platform and a broad coalition, we were able to win over the support of a majority on the Board of Supervisors to say that deal was not good enough. And that really forced CPMC to come back to the table to renegotiate a new deal. But this time it wasn't just with the mayor's office at the table, which it had been up till that point, but now, beginning in the fall of 2012, the new round of negotiations included three members of the Board of Supervisors.
Out of those sessions, a final development deal significantly different from the original was struck. This version includes many of the coalition's demands. Most significantly, the new Cathedral Hill Hospital will be close to 50% smaller, and St. Luke's Hospital will be 50% larger than originally proposed.
It was supposed to be closed by 2009, and it's 2013, and not only is it still open, but CPMC is going to be investing $300 million in rebuilding it.
Shortly after the new development agreement was announced this spring, CPMC agreed to fair contracts with the California Nurses Association and the National Union of Healthcare Workers.
This outcome and this project is an example of how coalitions, in this case of community and labor, can truly make a difference, can truly lead to an outcome that no one thought was possible.
I think now we're trying to figure out, well, what does accountability look like? What do we need to do to make sure that it just doesn't look good on paper, but it actually happens in the right way, and it happens with a community input and process. So I think that's kind of getting figured out right now is, what does accountability and monitoring look like, enforcement of the terms of the development agreement. But I think overall we feel really excited about that we can say that, yeah, St. Luke's is going to be around for the long term.
The victory for the Labor Community Coalition not only saved a critical hospital serving marginalized communities in San Francisco, the new plan will also ensure employment opportunities, new affordable housing, and was a huge step forward for CPMC's relationship with its unions. In the end, the years-long struggle will benefit not only the communities represented in the coalition, but all San Franciscans for decades to come.